recently had the privilege of speaking with Catherine Liao, Vice President of Government Relations at Duke Health. Catherine plays a pivotal role in helping Duke Health advance our missions with local, state, and national government entities and representatives. So Catherine, thanks for joining me today. I feel like we're seeing a lot of each other lately, but I think it reflects how important government relations and that function is to our missions. So how do you make that all work?
Yeah, thank you for having me. It's nice to be here. We lead government relations for the health system and the schools of medicine and nursing. So every day we're meeting with lawmakers or their staff by phone or Zoom in person to share about the academic missions of Duke Health. We coordinate with the campus side and just are informing and educating and at times urging them to support what we do for patient care and education and research.
So you mentioned campus. Some issues are really unique to Duke Health, but some of them are broader. So how do you work with teams on campus?
Yeah, we collaborate with the Office of Government Relations for Duke University that oversees the big Duke issues. So let's say student loans right now, also some proposals to cut those back. And then we'll monitor our team, Julie, Katie, and Brian, at the state and federal levels, any kind of health proposals that affect our workforce, our research, patient care, payments to the providers giving that care. And so we coordinate with the kinds of lawmakers we're talking to and making sure that Duke Health is on their mind when they need a resource or expert to talk to. We also collaborate with faculty, staff, and students who are active in their associations or want to be involved in our advocacy, and also present to many departments across the school about what is happening in Washington and Raleigh.
So there's a whole list of issues and challenges right now, and some that we're anticipating. What are the things that you and your team are preparing for?
So for the School of Medicine, we have been working to oppose the active and proposed cuts to research since mid-January. And then there are additional proposals to cut programs like Medicaid and Medicare that affect the health system. So in combination, again, we're sharing with lawmakers what the academic mission is and how it should be protected in the name of discovery and for patients.
So when you're having those conversations with the various teams, how are you communicating and giving them information that they can use?
We share a lot of examples about what kinds of research are underway here. If it's cancer or Alzheimer's, what kind of impact the real cuts have had already and what additional cuts would mean in limited research or what that does to our research workforce.
So has there been a moment in the last 2 months where that information has surprised some of the staff and actually had influence?
Yes, the facilities administrative issue is complicated, but we've been able to inform a lot of the congressional staff about why those costs are so important with analogies to buying an entree at a restaurant and that you might need to consider the wait staff and the building and the ingredients that go into it. And so they have come to understand you can't do one without the other.
So there's a lot of opportunity to influence, largely through our own stories.
Yes, they are welcoming the information. There's a bit of an information vacuum with all of the changes and so many changes at once. So they appreciate hearing real day-to-day examples of how things are changing.
So our faculty, our students, our staff, they're passionate about what they do and want to advocate when it's appropriate. How do you advise them on how to do that?
We certainly encourage that individual advocacy that is any individual's right to do. Under the Duke guidelines, as a not-for-profit, we comply with state and federal regulations about the kind of lobbying and advocacy we do. So there is information on a school medicine website that shows some examples of what that advocacy could look like, but we highly recommend that you're doing it in your own time, on your own resources, using your Duke affiliation, but noting that they're your personal views.
And do you recommend they come to you if there's an opportunity to advocate so that you can walk them through the process?
Yes, always. We are here to support that advocacy and promote that expertise. So if a student group wanted to invite someone to campus, please be in touch with our office so we can coordinate. And then if a faculty member is wanting to be in Raleigh or DC, we can advocate with them and just support the opportunity.
So how many years have you been in this role?
I've been in this role 6 years, 13 years at Duke, and it is the people here that make it day to day so rewarding. The kind of ambition and humility that every Duke expert I work with exudes when they're sharing their background with a lawmaker, it changes policy ideas.
Sounds like it gives you a sense of pride.
So much pride.
Well, Catherine, thank you, and thank your team. You do so much of the work that we need to help us be more effective advocates for what we do.
Thank you. Thanks.